First, I'm doing my hand hygiene. Wear my gloves. And wipe my stethoscope. And check my patient ID file. Okay, date of birth, patient name, acuity. So, hi, my name is Pratna and I'm a student nurse. So today I'm gonna perform predictive assessment. For that I need to touch you. Is that okay with you? Yeah. Do you wanna use the washroom? No. So I'm gonna pull the curtains for the patient privacy. Do you know where are we right now?
In the college.
Can you say me your name?
Ekta.
What time it is right now?
It's in the morning.
Okay, thank you. So my patient is alert, awake, and oriented times 3 to person, place, and time, and no any order, and the skin color matches with her ethnicity. My patient height is appropriate with her age, and my patient is in upright posture in sitting position, and her body is symmetrical, and the body is symmetrical. No any physical deformity visible, and my patient is dressed appropriate with the surrounding environment, and my patient is able to maintain eye contact, and the facial expression is calm, and the speech is clear. So now just for the face, to the face is symmetrical, no any scars, no any lesions, and no any tenderness. So now I'm gonna test for the cranial number 7, which is facial nerve. So can you please smile? Can you smile with your teeth? Can you puff out your cheek? Can you raise your eyebrow? So now I'm gonna apply the resistance, and you have to close your eyes. You have to close your eyes against the resistance. So all the movements are symmetrical. And my and my client is able to close her eyes even with the presence of resistance. So all the movements are symmetrical, and the cranial number 7, which is a facial nerve, is intact. So now I'm going to the eyes. No any lead like no any lead lag, eyebrows are symmetrical, and the lashes are evenly distributed, sclera is white, and the conjunctiva is pink with the tiny blood vessel. Now I'm gonna test for the cranial number 3, which is oculomotor. So the pupil size is 4 mm on the right side, and the pupil size is 4 mm on the left side as well. And the pupil is symmetrical, and it is in the round shape with the brown color. Yeah, with the brown color. So now I'm gonna test for the direct and console right. Can you look straight?
So is no tenderness, no superficialness.
Whenever I pass the light to left eyes and the right eyes, both of the pupil constrict. So now I'm going to the console light. Whenever I pass the light to the left eye, the right pupil also constrict, and whenever I pass the light to the right eye, also the left pupil constrict. So the cranial number, both of them are symmetrical. So now can you please look at the tip of my pen light? So whenever I bring the pen light near to her eye, both the eyes converges and the pupil constrict. So the cranial number 3, which is oculometer, is intact and symmetrical. So now for the nose is mainline, and can you look up and no any visible discharge. And for the ear is symmetrical, and no any discharge. So now I'm gonna look for the mouth. Yeah, and then and the lip is pink and hydrated. Now I'm gonna test for the cranial number 9 and 10, which are glossopharyngeal and the vagal. So for that I need to use the tongue deep pressure. Whenever I put my tongue deep pressure in near to your tongue, so can you please say ah?
Could you please help me confirm your first name and last name?
So whenever I put my tongue deep pressure in her near her tongue, both of her upper soft palate and the uvula rises, and uvula is moist and hydrated. So now, and the cranial number 9 and 10, which is glossopharyngeal, and the vagus are intact. So now I'm gonna test for the cranial number 12, which is hypoglossal. So